Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chance, and I'll be your host. Our webinar today looks at well-being measures and how they can be used to help communities fight poverty and despair. And it's really an honor to have our two guests, Anita Chandra and Carol Graham, with us today. They're both widely recognized experts in the measurement of well-being. Dr. Chandra is the Vice President and Director of the RAND Division of Social and Economic Well-being, and Dr. Graham is the Leo Pasvolsky Senior Fellow and Research Director for Global Economy and Development at Brookings. Anita and Carol, thank you so much for being here today.
Thank you, Dave, for inviting us.
I also want to thank the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any positions expressed in this webinar aren't necessarily those of ASPE or the Institute for Research on Poverty. So, but with that, Anita and Carol, thank you so much for being here. I'm going to turn it over to you now.
Great. Thank you, Dave. This is Anita Chandra, and thank you again to the Institute for Research on Poverty for the invitation for Carol and I to speak. I'm going to just kick us off with sort of a broad overview of what our presentations will cover today and some centering definitions. I'll then turn it to my colleague, Carol, and then I'll come back and talk about the local application of some of this well-being work. So our roadmap to the presentation today will cover basically three parts. One, just to kind of center the conversation on how we're defining well-being for the purposes of this presentation and why this growing focus on well-being, particularly in the U.S. We're going to turn to Carol, who's going to share more about her research and really deep analysis on well-being, its relationship to things like hope and resilience. And then I'll come back and talk a little bit about some local work and where well-being measurement is going, really in the application and appropriateness for policy development and program design. So for the purposes of this webinar, we just are going to use a fairly short definition of well-being, and just to ground us and to make sure we're all on the same page. There are certainly many definitions out there, but in this context, we're really referring to the comprehensive view of how individuals and communities experience and evaluate their lives. Carol and myself, along with the Robert Wood Johnson Foundation, actually developed a little bit of a visual of how we think about well-being. A lot of the focus, certainly, of research to date has been on individual well-being, the subjective experience of well-being, and that's absolutely critically important. But we also want to position this work in the context of other dimensions and layers of well-being. What's happening at the community level in terms of the resources and supports that actively promote or detract from well-being? What's happening at the policy and governance level that supports a civic context for well-being? And certainly it's important to also think about the intersection of the well-being of place and planet, both in the context of human welfare, but also in the context of the well-being of the environment in and of itself. So hopefully these visuals and these definitions will help ground today's discussion. The other thing that we just wanted to note is that this is certainly growing as a global hot topic. Of course, there have been people who have been thinking and talking about this issue for years, and certainly Carol is a leader in that conversation. But there's certainly new resonance and new energy around well-being. People are thinking about it in the context of a kind of a post-GDP or a complement to the GDP. People are thinking about it as a measure of also our values in terms of how we think about human growth and potential and thriving. And places like the UK, New Zealand are now putting into place national efforts to think about budgeting against well-being dimensions and outcomes. And so we just wanted to kind of orient everyone on the phone to this context in which we'll talk about the research and some of our examples of local application. I'm going to turn it over to Carol now to continue on.
Okay, well, thanks, Anita. It was a great intro to the kind of where the field came from and is going. Just so you all know, I come from this as one of the early so-called crazy economists that worked in this well-being space starting about 20 years ago. And at the time, we were considered literally nuts to be talking about happiness or life satisfaction or whatever it might be, some of the mood data on positive moods, negative moods. And a lot of our critics, which included Angus Deaton, who eventually bought into the approach and ended up using a lot about happiness research and broader well-being research in his Nobel speech, and many other mainstream economists who thought this was absolutely kooky and now realize that understanding the human dimension of how people experience economic growth and all other parts of life were actually very fundamental to making the right economic policy, doing the analysis right, and beyond economics in sociology, in psychology, and in governance, that this data could really be useful well beyond what we'd ever imagined. And in fact, and as Anita noted, there are governments around the world now that incorporate these metrics into their statistics on a routine basis, and that includes the UK, which was a leader in this, New Zealand, as was on Anita's slide, a couple of local governments in the U.S., and then many other governments around the world. So we've gone from, those of us working in this space, particularly in economics, have gone from being crazy outliers to seeing progress that we never thought we would actually see. And I think one reason for that, certainly not the only one, a lot of academic research and progress and refinement of the metrics helped a lot, but I think the other one was the 2008-2009 global financial crisis and a real questioning of standard economic models and what they had missed. And in fact, what they missed was how a lot of human beings were experiencing economic processes that were leaving them out. They also missed a lot about contagion effects in markets and other things, and these metrics are good at capturing them. So what I thought I would do today in the brief time I have is introduce you a little bit to the kinds of things we can measure and how we measure well-being in a robust way, and then some applications to the current deaths of despair in the United States, and which relate to poverty, but not only to poverty. They also relate to low levels of well-being, and then what can be done at the community level and at the poor community broadly defined, because I'm going to tell you a story not about despair among poor people, but actually very differential levels of resilience among poor people, and how can we learn more about the resilience of the populations that are resilient versus those who aren't. And Anita is a real expert on resilience, and she will probably tell you more about that after I go. But so let me just press ahead here. And one of the things I've been doing, I spent a lot of my time working in poor countries and showing that the determinants of well-being in poor countries were very much the same as in rich countries, and actually the standard determinants of well-being are the same all over the world. There's an incredible amount of consistency across populations in terms of what accounts for high levels of well-being and low levels of well-being. And I've also done a lot of work historically around the world looking at resilience and optimism among very poor populations in poor countries. But over time, looking at the U.S. and what was going on here, and the sort of particularly depressing nature of being poor in a rich country, I decided to take a deeper look into inequality, both in terms of outlooks for the future and outcomes, from the perspective of these metrics, and thought I might be able to tell a more compelling story. And I started with a question, which is in the Declaration of Independence. The U.S. is unequal by any number of measures. So is the American dream and the right to the pursuit of happiness equally available to all citizens today? Spoiler alert, probably no surprise to most of you in the audience, the answer is a great big no in capital letters. And my research using this metrics explores why the increasingly unequal distributions, not just of income, but well-being and beliefs in the future and hope, matter today and will matter even more for the next generation. The 2016 election certainly woke us up to a very divided country with people with very different outlooks of what the U.S. was, where they would be, what they wanted. But an even more important and worrisome marker is the fact that the U.S. is the only rich country in the world where mortality rates are going up rather than down, and those are driven by premature mortality among less than college-educated whites, primarily, but not only in the heartland. And I'm going to speak more about that. But one of the things about those mortality rates is they're very clearly related, robustly related in a statistical way with despair among these same cohorts. So we find more generally around the world that individuals with more positive attitudes about the future, who have hope, not only have better levels of all other markers of well-being, but this being hopeful about the future is linked with more willingness to invest in it and in better future outcomes in terms of health, income, social behavior, and even longevity. And people with more limited future opportunities and lower levels of well-being tend to have higher discount rates. The discount rate is how much you're willing to postpone, saving for the future postpone current consumption to save for the future. And what we find is people who don't believe in the future are much less likely to postpone current consumption for the future, in part because they tend to have limited means, but in part because they just don't have confidence they'll pay off. And that results in much worse future outcomes. The same cohorts tend to focus much more on daily experiences. They lack the capacity to plan ahead. And you can think about the lives of poor or vulnerable, not just poor people in the U.S., who are vulnerable to negative shocks if they don't have health insurance, if they have a very, sort of a insecure job, somebody in the family gets sick, they lose the job, the car breaks down, whatever it might be can be a negative shock that sends them into a sort of a spiral of negative shocks and a vicious circle. So this is what I call bad stress. If life is so stressful on a daily basis and that stress is driven by circumstances beyond individuals' control, it's incredibly bad for their well-being as much as it is for their income generation and everything else. And it's also psychologically very difficult to adapt to negative shocks that are beyond your control because they're uncertain, you don't know when they happen, and your coping skills aren't very good at dealing with these things. So quick note about terminology, this is a more general point, is that even though happiness is in the title of my books and it gets a lot of public attention, it's not a great research term because you can have happiness at the moment, are you content now, or you can have happiness in general, which tends to be a kind of longer term kind of question. We are now much better than we were when we started this at dividing up these well-being dimensions. I call them from Bentham to Aristotle because the first, hedonic well-being, measures how people experience their daily lives. Their mood, is it positive or negative? Are they smiling or worried? As they do different things like commuting, spending time with friends, or working. And that's what I call the Benthamite kind of well-being because Jeremy Bentham thought of well-being as the most contentment for the most number of people. And then when the other dimension of well-being that we focus a lot on is what we call evaluative well-being. That is more Aristotelian in the sense that it captures not just people's contentment at the moment, but their feelings about their life as a whole. Is it purposeful? Is it meaningful? And what we find that life satisfaction correlates more closely with income than hedonic well-being because people with more means are more likely to assess their lives as a whole or their life circumstances as a whole more positively because they have more control over the kinds of lives they can have. So that doesn't mean that more and more money leads to more and more life satisfaction, but it does mean that not having means, being destitute, is terrible for well-being. We also measure life purpose and fulfillment explicitly, but I'm not going to go into that because of time. So here's a measurement slide, and don't freak out about the equation for those of you that don't like equations. But it is important to understand how we measure this stuff. We're not running around and asking people if particular things like work or being with children or smoking or exercising or, inequality make them happy or unhappy. What we do is we have very large end data. I'm an advisor to Gallup, and with those data sets alone, let alone all the other ones that are out there, we cover millions of people around the world. And also millions of people within the U.S. The Gallup World Poll covers the world. The Gallup Daily for the U.S. interviews 1,000 people a day. So we have a very large samples and can track well-being across people both over time and across countries and states or counties or whatever it might be. And what we do with this data is we take the well-being of individual I at time t, and the well-being could be life satisfaction, it could be hope for the future, it could be stress yesterday, it could be anger yesterday. We have a battery of questions as the first, early questions in the survey. And then we control for demographic and socioeconomic characteristics in, that vector X that's on the slide. And those tend to be very standard variables that track the same way across populations everywhere. Then we have an error term, and in standard economic equations, that error term is tossed out as, as error. You can't explain it. Your equation isn't explaining it. But it turns out in well-being work and regressions, that error term is capturing what we can't explain about well-being, and a lot of individuals' well-being is innate character traits. Some of that's genetic, some of that's psychological, but there is a large component of well-being that's unique to people, and that that doesn't mean it doesn't change over time or that circumstances will never change it, but we have to think about well-being as something that is determined in part by the environment people live in and navigate, but in part by their innate character traits. So the most important thing on this slide is that we're not asking people if X or Y makes them happy. We include whatever we're interested in that varies in these equations once we control for everything in that first equation. So here's just to give you an example of what is consistent across people around the world is this U-curve in age. So the horizontal line is years of age. The vertical line is level of happiness or life satisfaction. This is Latin America data, but it holds. We found that this holds in over 100 countries around the world. It tends to not hold in countries that are terrible to age in, whether because of violence or poverty or whatever it might be, or lack of good safety nets. And the U-curve turns at where you might expect, the middle-aged years. It turns a little earlier for happier people, so there's a no justice part of this equation, so happy people get out of this midlife low earlier, and they live longer lives and more happy life years because they're happier. It turns earlier in happy countries compared to unhappy countries, so it turns in Russia, which has low levels of well-being, at about age 60, which is roughly life expectancy for males. And you all can draw your own conclusions about what happens with the females as the men are dying off. There's selection bias in this curve because unhappy people die earlier. So as people age, the sample actually goes down a bit as the less happy people die off. And this curve is explained by a number of things. It's the usual sort of middle-aged double burdens of young children, older parents, aspirations aligning with reality, whatever it might be. Psychologists describe this as emotional wisdom as people age. People have less emotional swings and become emotionally wiser as they age. There may be a happy to be alive effect or more appreciation of daily life as people age. And just two last points on this slide. One, this curve holds even for chimpanzees. A colleague of mine, Andrew Oswald in England, did a study with a group of people of cheerfulness in apes, and they found that even apes have a downward trend in their cheerfulness in their middle-aged years. So there's something that's biological going on, which goes back to the point that well-being is both determined by kind of innate traits as well as the environment. But back to what I'm going to talk about now in much more detail, Americans the deaths of despair among Americans are happening precisely in those middle-aged years, so between 34 and 60 roughly, and a large number of Americans, at least 1 million since 2005, have not made it out of that due to preventable deaths, suicides, opioid poisoning, and alcohol poisoning in that cohort, less than college middle-aged whites. So here is a big social problem, a health crisis, a social crisis. It's a crisis of despair. And I think it's a good example of how well-being metrics not only help us understand something, a phenomenon as big as this, but can maybe shine some lights on potential solutions. So very quickly, I'm actually going to skip this. It's a wonderful study about different visions of America, but I'm going to run out of time. Basically, what you can see if you just look at the last 2 points on the slide is that the common words in poor America, this is based on a Google word search, are guns, religion, hell, diabetes, antichrist, video games, and fad diets, a vision of life that's very much living at the moment. This is in difficult places to live. The common words in rich America, think San Francisco versus, Detroit. The common words in rich America are iPads, baby joggers, baby Bjorns, and exotic travel destinations like Machu Picchu. So what you're seeing is a completely different vision of life. One is very much about just coping, and the other is very much about investing in your knowledge, your baby's knowledge, your health, and broadening your horizons. And this shows up very much in the well-being data as well. It's reflected in it. So I started initially by just looking at the U.S. compared to Latin America on markers of well-being and ill-being. And as you can see from this slide, Americans experience much more stress on a daily basis than Latin Americans. But what you also see is the gap between the scores of the poor and the rich are much greater in the U.S. So the poor, who are on the left-hand side, the poorest quintile, have more stress than any of these other groups, and significantly more stress, not only than the rich in the U.S., but than the poor in Latin America. And this is what really struck me. This is a question called, if an individual works hard in this country, he or she can get ahead, yes or no. Now, that's a classic American dream question. We're the land of opportunity, the Horatio Alger Society. If you look at this slide, it's telling a different story. As you can see, the gap between the poor and the rich in their responses to this question is 20 times greater than the gap in Latin America. So there's no difference, actually, no statistically significant difference in the way that Latin Americans answer this question, whether they're poor or rich. But in the U.S., the gap is 20 times greater. So something is going on in terms of U.S. perceptions of the future of the American dream. So what more could we learn about this? So one of the things I did, and excuse that very crazy big slide equation, you don't have to worry about it. I decided when I got those findings to see if there were differences across minorities in the U.S. And I compared in responses to a question about optimism to the future, the responses of poor blacks, poor whites, and poor Hispanics. At the time I did this, nobody knew about the deaths of despair. There were riots in Ferguson and Baltimore, and a lot of concern about the state of the African American community. And what I felt going into it is that I would have sort of negative optimism among poor African Americans compared to the others, that poor whites would be in the middle with not much of a story, and poor Hispanics would be optimistic because they typically are. And instead, this is what I got, and it surprised me. So what you see is poor blacks are, the left-out group on the vertical axis is poor whites. Poor blacks are almost 3 times as likely to be optimistic as poor whites, and poor Hispanics are somewhere in the middle, again, more optimistic than poor whites. When I found this, I didn't understand it, and I started doing a bit of research into African American resilience and other things that made it make more sense. But about 6 months later, the first study on the deaths of despair by Case and Deaton came out, which was highlighting that these deaths were driven by basically lack of hope for the future among poor middle-aged whites. And blacks and Hispanics are barely represented in these deaths. So and if you want to look at a different measure of well-being, you get a similar pattern. Blacks are half as likely to report stress the day before than poor whites, and Hispanics a little more so. We know objectively that poor blacks and poor Hispanics don't have less stress than whites. It's just they have higher levels of resilience. So I went on to say Well, I wonder if we could have had warnings of these deaths of despair if we had been tracking well-being regularly the way the Brits and others do. And if you look at this slide, here again are the deaths of despair, all-cause mortality in this suicide, alcohol poisoning, kind of premature, preventable death category for middle-aged groups. And you can see all these are rich countries, and the dark blue line is U.S. Hispanics, and you can see it's U.S. whites that are the only cohort where mortality is going up rather than down. In every other country, and among U.S. Hispanics, and among U.S. African Americans, mortality is gradually going down. So one of the things we did then was to try and match our metrics of hope, despair, anger, worry, stress with individuals and counties that were vulnerable or not to deaths of despair. And we indeed found that both at the MSA and the county level, that the composite death rate for 35 to 64-year-olds is negatively correlated with life satisfaction and optimism, and positively correlated with stress and worry. We also found that on average, places that had more diversity, had better health behaviors, like less smoking, more exercising, had higher levels of optimism, lower levels of deaths of despair, and that there's a story about coast versus heartland here. So what then do we know about place and community in these trends? If you look just at the bottom slide here, this is optimism across states, across U.S. states, controlling for all kinds of objective factors like unemployment rates, health indicators, everything else. This is just raw optimism that isn't explained by everything else. And if you look at the very dark green states, those are the states where minorities are most optimistic. And there's states, the southeastern cluster states, southwestern cluster states, particularly the southeastern cluster states, we know have racism, poor health indicators, all kinds of other things, a lot of discrimination. But the other thing they have is a concentration of African American community, culture, music. And here in the southwestern cluster states, you have, again, a concentration of Hispanic culture, families, whatever it might be. And we see that there's an additional role of place that helps explain some of the trends in optimism and desperation. And if you look above at the optimism among whites, and you see those very white states, those are places with the lowest levels of optimism. And if you were to impose a map of deaths of despair, reliance on disability, reported pain, and many other similar markers of despair and ill-being, you'd get a very similar map as we get if you look at where there's low optimism. So very quickly, I probably have about 3 more minutes. What we're doing going forward is trying to understand differential levels of resilience. Some of this work I've been doing in Peru, where I'm from, because there are plenty of poor people, but it's a place with a lot of hope and a lot of belief in education. And I did a survey of poor 18 and 19-year-olds and found that 85% of these poor 18 and 19-year-olds reported or aspired to go to college or postgraduate education, even though none of their parents had attended college. They also had higher levels of life satisfaction, lower discount rates, fewer risky behaviors. And almost all of them had also had one or negative shock in the past, like being a victim of crime or losing a parent or something. So again, reflective of resilience. But what's remarkable is this very consistent belief in education. And most of these kids, because we have past data on them, have aspired higher and achieved the education they aspired to. So these aspirations are linked to reality. What I'm doing now is surveying poor African American neighborhoods in St. Louis and poor white former manufacturing neighborhoods across the river to explore the same question about resilience, hope, and aspiration, and education aspirations. And the pilot results, as well as my conversations with educators, heads of historically black colleges, and many other people, are that poor minorities still believe in education and its value in getting them ahead, and poor whites don't, which is a pretty tragic spot to be in, but I think we need to understand this better. Can we restore hope and resilience in places it's been lost? It's sort of the point of this exercise. And then lastly, we have a new study based on the U.S. PSID, the Panel Study of Income Dynamics. It shows that respondents born in the 30s and 40s who reported to be optimistic in midlife live longer, they do better. And the one group that had a drop in optimism in the 1970s, coinciding with a decline in manufacturing, were, you guessed it, less than college-educated whites. So the point here is we could have predicted the despair we're seeing today before it became a full-blown crisis. Okay, I don't need to really go, I want to give Anita time, but the last point is if we had been tracking well-being regularly, as they do in the UK and other countries, we would have picked up on this crisis of despair much sooner, and I think it wouldn't have gotten to a point where we really can't turn it around. I mean, eventually we can sort of do things at the margin, but I think we should be thinking about these metrics as leading indicators in the future, and not just of individual well-being, but community well-being or cohort well-being. So I'll stop with that, and over to Anita.
Great. Thanks, Carol. I'm happy with that last point that you noted, because it's exactly the work of Carol and others over the last several decades that I think lays the groundwork for now how do we make this research real, and how do we think about actually getting ahead in the next period of the American future in terms of systematically assessing these things. Some of that has to happen nationally, and I think there's some great movement in how to do that in national data sets. But also a lot of the movement is happening locally, and that's what I want to talk about in our remaining time together. I don't need to kind of reiterate some of the important points that Carol made, but about the importance of why we're thinking about well-being measurement and what it means to intervention, policy, and program. But one of the reasons that cities have really taken this focus at the local level is that they are acknowledging the need to get ahead and support the well-being of residents. They are acknowledging the need to get beyond just simply GDP by itself, and a need to create holistic and integrative strategies that really stretch the bounds of what local government can do in partnership with civil society and business, to not simply just focus on the critical, usual routine functions of cities like filling potholes and completing permits, albeit important, but also what they're actively doing to address issues like hope and despair and some of these upstream issues that Carol articulated in the last part of the presentation. And there has been such a great work on well-being measurement and such great science that has come from the work on subjective measurement, and now, as Carol rightly notes, thinking more about community and cohort well-being. But the measurement work has really fallen short in a few critical spaces. One is that it sometimes has happened separate from how governments function and how they think and how they make plans. There has been less focus on how to coordinate around a common well-being agenda, although you're seeing that more and more, certainly outside of the U.S., but increasingly in the U.S., and then how it gets tied with resource allocation. So as I noted earlier, the examples of New Zealand tying a well-being budget, well, we're starting to see that take root now in the U.S., and how are communities doing that? So one example of a community that's really taking a leadership role in this is the community of Santa Monica, California, and Carol is actually one of our key expert advisors on this project. And Santa Monica, in many cases, some people will think of it as the beachside community, but has a lot more of some of the critical issues that communities across the country are addressing. High issues of homelessness, economic opportunity, racial equity concerns, and other social and structural barriers to improvement across all populations and all communities. And they were worried that they weren't necessarily orienting as well as they could towards investments that would actually help the population thrive and flourish. They were starting to see the numbers and the data points that Carol articulated, and they wanted to think differently about how local government was taking stock of well-being oriented measurement, getting ahead of the curve, and actually embedding well-being thinking into policy development, into local budget decisions, into the business of city government. And that's what I'm going to briefly talk about here. And so we took the expertise of global experts like Carol and others and said, okay, let's take the dimensions that we know matter for well-being, and let's also put it in a framework that makes sense for city government. And so there are a lot of well-being frameworks out there that measure multiple dimensions, and some of the frameworks have 8 to 10 to 12 dimensions. But we said, look, we've got to kind of distill it down to a manageable set that could actually make sense in the context of the roles and functions of city government, but also we're true to the science and the research behind well-being. And so what you see here at the top part of above the blue bar is essentially the 5 core dimensions of well-being that we came up with, ultimately leading to that improved outlook that Carol described in her presentation, this issue of thriving and flourishing and optimism and hope that are so central to not only economic progress, but health outcomes and other community well-being measures. And we wanted to create a framework that essentially brought the best of science, but could also be flexible and adaptable to other communities. And this framework is now being used outside of Santa Monica. And essentially, I'll walk through this framework just briefly over the next few minutes. We had 5 dimensions. One, to look at community structure, so getting at some of those issues of civic engagement and identity and connection. One that looked at the context of place and really got at the well-being of the environment and some of those critical opportunity variables. Certainly we know that enrichment across the lifespan and lifelong learning is central to people's ability to thrive and flourish. So the appreciation of education, as Carol noted, but also all the other elements of learning across the lifespan, being able to pivot as economic opportunities change. A broader conceptualization of health that includes all the dimensions that are now being factored, like spiritual, emotional, mental, and physical health and the amenities that are provided in a community. And then finally, aspects of economic opportunity. And for each of these dimensions, we created a structure that would be fairly stable that had 3 subdimensions. And the reason why we did that is to say that this is portable to other communities. They can all measure these subdimensions. They all matter for the well-being outcomes that we seek and can actually be used by communities to invest and make choices. But the measures and the data points could vary by community. And that was, for us, a more realistic view about the heterogeneity of local data systems and the flexibility and the cultural context that different communities have to bring to the table. And so we went about our business in Santa Monica applying this framework, which I'll talk about in a minute. But again, it is a framework that can be adaptable and flexible to other communities that are wanting to embed well-being thinking into their practices going forward. The other thing that was critically important was that we thought not only about survey data, which a lot of the focus has been Gallup and other polls like that and surveys, which is important, but to really embed it in city processes, you had to think about what data the city was already collecting on not only outcomes, but administrative and investment processes. And we wanted to be live to the social context of new data, the social and social media data. And so we brought those data pieces together to allow us to measure well-being in Santa Monica. And Santa Monica is now in its 3rd iteration of measuring progress along well-being. So let me just give you a little bit of a deep dive on kind of how these dimensions bore out, and certainly after this conversation I'm happy to share more offline. So essentially we had our 6 dimensions. We had our ultimate outcome outlook dimension and then those 5 dimensions that I mentioned earlier. And so we ultimately want to improve how people are doing, their outlook on their life satisfaction, and some of the dimensions that Carol noted in terms of both the hedonic experience, the sort of day-to-day emotions, as well as some of these evaluative life appraisal dimensions. And so here's just an example of the kinds of things that resurfaced in Santa Monica, which were very informative for their planning. So while there's a lot of things that are going well in Santa Monica, I think they were surprised at the level of stress that some or all of their residents feel. This is not unusual in cities across the U.S. and globally, but it's not something that city government generally tracks. And as we saw in Carol's presentation, these are the kinds of things that are actually critical as we think about outcomes for communities over time. Getting ahead of measuring that is absolutely central. We also wanted to understand that sense of community, and in that you are looking at things like social connection, cohesion, some of the actual drivers that Carol noted about resilience that are meaningful about how people connect to others and to place. And this was also instructive for Santa Monica, who thought of themselves as a fairly small, well-knit community, and they are in many ways. But again, they had areas of need. So this is an example of one of the indicators that we used, which was about how people felt like they can count on their neighbors, a classic measure in community connection and social connection. But again, Santa Monica was a little bit farther off than they actually would have predicted before they actually asked the question of their residents. Again, illuminating to understand where the opportunities and potential fracture points were in their community health and well-being. We also asked questions about civic engagement. This is a community that has a very high national voting rate in terms of the presidential and congressional elections, and yet felt that they couldn't be part of civic and city decisions. We know from early work around participatory democracy and engagement that this is meaningful in terms of people's sense of opportunity. And again, it was a striking finding that without asking the question, we would not have known. So some of these findings came from survey, but we also had comparable findings from social media and other outlets as well. We looked at the context of place, and again, this comes from the well-being literature. So classic measures of the built and natural environment, but also how people perceived the quality of the built and natural environment, their connection to the environment, their connection to place, and also the quality of the services that were being provided in the community, the ecosystem services, the built environment services. And we brought that together to try and give us a visual and an understanding of the dimension of place. We tried to unpack learning. Now, too often, a lot of what city governments track are educational attainment by itself, which is important, right? You want to know high school achievement rates, college readiness rates, these kinds of things. But we expanded that to really understand enrichment across the lifespan, which again is not only important for economic agility and diversity of the economy, but also critical for the cultural and social enrichment that is central to people's feelings of hope and optimism. We looked at aspects of health, which should, fairly straightforward, but we were much more focused on what we call well-being amenities and looking at the promoting resources in the environment. This is where we were able to use administrative data and not simply people's self-report. And then finally, we looked at these dimensions of economic opportunity, but not simply about people's perceptions around affordability, but aspects of the economy and the business diversity that was sprouting up in the community. And we looked at it through survey data like here in terms of affordability, and which is a big issue in terms of the life course of Santa Monica. Do they have the potential for people to stay and live and work? And that is meaningful from a generational economic development perspective. But we also looked at, Twitter, and we looked at what people were talking about and could triangulate some of that information. So we used Instagram data, Twitter data, and other social data. Again, not as complex for city governments to do. Once we got the structure and the framework in place, they could build on this over time, using the same framework, but building in new data as it became available. Now, all of this was important from a measurement perspective, again, bringing the best science, but the real focus was on end use from the beginning. How is this actually going to get used at the local level? And one of the ways that it's now being used is that it's the guiding framework for city planning, for internal performance monitoring and measurement. The city is also using it to guide budget allocations and choices so that departments have to think about what they're doing against the dimensions of the framework, which gets them out of a kind of a process-only counting kind of dimensions of how city governments sometimes run, or too far afield of latent outcomes and not enough of understanding where their investments are having upstream impacts on things that we care about in the the well-being framework. So now master plans, community plans, budgets are happening at the macro level at the city of Santa Monica, but also there's a great grassroots effort that's now cropping up with community organizations, neighborhoods looking at this well-being data and saying, we can do something about this. A nonprofit organization has a role to play in the dimensions of well-being. A business has a role to play. Santa Monica is giving small micro grants and pilot programs for people to do interesting things with the data. They've engaged design students to translate the data and motivate conversations about well-being, about community connection, about despair. So all of the things that Carol described in the research are now getting translated in the context of government and local community practice. I just wanted to end with kind of another forward lean, just to leave you with some ponderings of a project that we are engaged with. It's a partnership between UCLA RAND, the Children's Hospital of Philadelphia. It's currently supported by the Robert Wood Johnson Foundation, and Carol is also a critical advisor on this project as well. You know, in the context of moving beyond just GDP as a measure of economic progress, there is an interest in trying to create complementary signal indicators or measures. And so the well-being framework in Santa Monica, and that's being used in other places, provides a dashboard for critical planning and allocation, but there's also some power behind a sentinel indicator that tells us something more about national and community progress. And that's what we're working on now. So the basic tenets are, you know, why create that is obviously to move beyond a narrow economic indicator, to understand changing complexity of our environment, and to look at some of those issues of inequities that Carol and others have identified in their research and analysis in new ways. So this is work in progress, but the idea is that the GDP2, otherwise known as gross domestic potential, would understand how human potential develops and how it creates the conditions of people to thrive. Again, taking a page from the need to systematically assess drivers and influencers of well-being, how can we move further upstream to capture human potential and capture the conditions for thriving? And so essentially this will be our first attempt to capture the potential of a nation against kind of a capability-based framework and the capability promise of the youngest cohort. So we've looked at literature, we've talked to experts, we've worked at the community level to identify a set of capabilities that are actually going to be critical for us as a nation going forward to help us reach some of the outcomes that we seek so that we're not in a situation of decreasing life expectancy for some populations. We're not in a situation of despair and hopelessness that Carol articulated going forward. And so the idea is to look at that kind of potential and how that is fostered and invested in a way that communities and decision makers can actually use, so that we can kind of reverse some of the trends that we're seeing by not considering well-being frameworks in our policy and programmatic decisions. And so I'll just conclude on this in terms of the 7 kind of developmental capabilities that we've come up with through our analysis. They're not going to seem dissimilar from some of the insights from Santa Monica, but they take us one step further to understanding if we are truly to get ahead of some of these issues going forward in a generational framework, how do we think about the kind of investments that we need to make in things like resilience, adaptation, social connection, community, and civic engagement? And so that's what we're working on now. That again is trying to take the science of measurement into the science of development, the science of government, and the science of practice. So I'll conclude there, Dave, and turn it over to Q&A. Hopefully we have about 11 minutes left.
Oh, that's so great. Thank you so much, Anita and Carol. And I just want to remind folks, so just type your questions into the Q&A box at the bottom of your screen. Yeah, we'll try to finish up in the next 11, 12 minutes or so. So, but as a first question, and Anita, I think I'll start with you here. But, you know, we've got a lot of folks from local agencies and governments online today. And, you know, so what does like a group of folks who are interested in bringing these sorts of measures to their community, what's that initial toolkit look like? How do they get started? Can you give us some guidance as to how we might get at that?
Sure, yeah, happy to. And I'm also happy to send a link to a toolkit that we developed, a starter kind of conversation guide with a team in Santa Monica, because I think that'll give us a start. I do think it's twofold. One, it's about bringing together the critical change agents in the community, both within and outside of government, who want to change the narrative and the orientation about the choices that the community is making. And that has to then go hand in glove with bringing and applying a framework like we did in Santa Monica. Our goal, quite frankly, is for people to take the framework and use it as is, adapt it to the data that you have and your priorities and cultural context, but the dimensions are fairly adaptable and flexible by design. And so I would encourage people to not reinvent the wheel in terms of the measurement piece of this, but to think about the hard work of end use, planning, and the narrative that you're going to change as the kinds of choices and investments that you want to modify through a well-being orientation. The measurement is not easy. I won't, underestimate it, but I don't think that is a piece of the puzzle. The real story is the narrative and end-use conversation, and use our tools, use the work of Carol and others to apply it to your local context.
Carol, do you have anything you wanted to add there?
Well, I think one of the things that we're learning a lot about going forward is that there are amazing efforts at the local context. I mean, the City of Santa Monica effort is incredibly impressive and well done, and I encourage everybody on this webinar to just go on that website and look at what they've done and what they've used, how they've used the findings based on good measurement practice and surveys of the community to then implement community activities and interventions and all kinds of things. It's sort of an ideal setup. But over time, I've been looking at pockets of local efforts that are using this approach and trying to take a community-based approach. And there are many efforts in a pretty desolate environment in the sense of what's going on with despair. There are many efforts that are actually turning communities around. But one of the things that I find in speaking to all of these, absolutely dedicated and wonderful community-level people is that there is an absence, other than in the academic literature and in some sort of these kinds of circles that sort of cross policy and academia, for a lot of local communities of knowledge of what other places are doing. And I think there is a role for us going forward to really provide almost a public information clearinghouse so people can really learn more about what other communities are doing. If they're involved in it and they just want to know how they compare. B, if they want to learn lessons from other places. And C, for communities that are very desperate but might have a good leader or two or somebody that's trying to change things, and realizing, A, that they're not alone, and B, that this whole approach can actually turn things around. So although I spoke a lot about deaths of despair in my presentation, there really are some positive stories that we can take a lot of hope from, but also some very practical lessons.
Thanks. We have a couple questions, just folks asking about if slides will be available. I do want to say that I forgot to mention this before, but if you click on the link in your screen, you should be able to download them from there. But we'll also have those sent out later. But as a next question, though, I kind of want to combine two questions. We've got someone that's asking about sort of the evidence on these negative shocks, and especially how that might contribute or detract from resilience, and also questions about these differences in resilience across groups and by gender. And Carol, do you want to start us off with there and kind of
sure, and that's something I have to admit I am testing out. I've repeated the survey I mentioned in Peru. It's in the field now. I'm going to be getting the results in the summer just coming out, but I'll get the full results by Christmas time. So one of the things, even in the first round of that data, was that the kids who had negative shocks that were a parent leaving the household, a parent dying, being a crime victim, sometimes many of these things, manage to navigate those, and often they seem to increase their determination to do well, to educate themselves, to help provide for their families. But the one negative shock that really didn't work in the same direction, and it makes sense, but it's also very relevant, particularly to the U.S. context, is if they had been sick themselves, right? So if they lost, it's very hard to be resilient and hopeful for the future if you lose your agency to, so if they'd been sick, they lost their ability to help themselves, to work for the future. And so that's a different, I think we have more to learn and do about kind of the intersect between resilience and negative shocks or other experiences that make you stronger. Certainly at the big broader population level, we can see this kind of resilience among the Hispanics and African Americans, not just in the short term, but over time, that's helped them build communities to support each other, to, more empathy for those who fall behind, all more multitasking, all kinds of things that are serving them well today in a context where, the standard blue-collar jobs that they didn't have privileged access to are gone and leaving soon, even more than that, but also that I think will help them in a future more flexible gig kind of economy where we don't really know where the future of work is going. So at some level, some negative shocks build resilience, and maybe they help people build informal community or other kinds of networks that help. But there's some negative shocks that you can't get over, and I don't think we really know that story completely. Anita may have some words to say about it, so I would like to hopefully hear her views on it.
That's right. Anita?
Yeah, I mean, in terms of the resilience across populations, there is definitely some work looking at kind of cumulative stress and what those kind of facilitates or doesn't facilitate in terms of competencies and capabilities. And I'm happy to point people after this call to that literature and some of that growing research and analysis. But there's absolutely been some work on kind of differential trauma experience in the child development literature. There's some work that might be relevant here as well. So yeah, happy to share more about that in more detail, I think, after the call.
Okay. We have an interesting question from Nebraska, who is asking kind of how the broader U.S. conversation, the policy conversation around poverty and inequality, how does that need to change to sort of incorporate these well-being measures? And Anita, do you want to take a first stab at that one?
Yeah, in terms of the conversation about inequality and related, my view is yes, and certainly Carol, as an economist, will have thoughts about this. And my reasons are kind of twofold. One is I think we don't get a full expression of how people are fundamentally doing through kind of narrow single-factor measures. And so, as we think about life course health and development, and we think about how people develop over time, and all of the elements that we know about developmental science, just having a measure of kind of gaps and disparities is not accurate enough in terms of comprehensive understanding of just human welfare. The second, though, I think that's also critical here is how we think about both inequality and also issues of inequity, which are two different things, and how we think about people's exposures and opportunity landscapes and power and intergenerational issues of not only intergenerational wealth, but intergenerational kind of development of health and well-being competencies. We get a fuller appreciation of drivers of inequality, I think, because we start to embed and imbue indicators that are suggestive of structure and system, and not simply, dichotomous or classic categorical measures of inequality. So I think that's also an important piece of that, and it helps to bring a more equity-based lens to the conversation. which I think is critical for some of the issues that Carol raised when you look at racial ethnic disparities and income disparities and all these kinds of things, that if we only look at inequality and gaps, we'll miss some of the nuance of some of those critical factors. I think well-being gives space. If you have those sub-dimensions that I identified through the Santa Monica work, you're able to capture some of those elements better.
And Carol?
Yeah, and those are all great points, and certainly in the economist world, I find, you often have even people who care deeply about poverty and inequality say, well, the unemployment rate is low, so there are jobs out there, what's going on? And it's like, well, if you take the unemployment rate ratio as it is, which is that if you haven't looked for a job in the last 6 months, you're not in the ratio anymore. So our unemployment rates, for example, of a key indicator that's missing the boat, they're artificially low because we aren't accounting for 20% of prime-age males who've dropped out of the labor force. Women as well, but the males are the more complicated cohort, particularly white males. And that's a story of deep desperation and, loss of a narrative for life and all kinds of things, and also not willingness to multitask and take other jobs. But it's a story that the standard indicators are missing, and it's not a small scale story. It's a large scale story. And so there's a lot in this complementary data that allows us to see what the standard indicators aren't telling us. And then there are a couple of bigger picture stories, in addition to the U.S., where deaths of despair are going up at this time that all our economic indicators, including stock markets, are saying everything's great. But in India and China, in both cases, when record levels of growth, first China, now India, and record levels of poverty reduction coincided with dramatic drops in life satisfaction and increase in suicide, something is missing in the standard indicators. And it could be, yes, that you're pulling people out of poverty, but certainly in China, that included a complete disruption of social safety nets and communities, and a huge migrant population that was earning more money by moving to the cities, but living in discriminatory and deprived conditions. So if you measured the incomes of people, they were going up. If you measured their life satisfaction, their human experience, it was miserable. And so, again, this is where we need to move beyond just the standard indicators. I'm very much not a fan of replacing GNP or GDP. I think they're incredibly important indicators that have served us well. It took a lot of time to develop to get right, and we still don't have them fully right. I think well-being indicators are an important complement. That said, we also still have work to do to get these right. So it's a moving process, but I think the indicators should be used together.
Okay. Anita and Carol, thank you so much for this wonderful presentation today.